Hello again. So this is the next part of our lung infection topic. Today we are going to discuss about the atypical pneumonia, and we shall complete with the tuberculosis. In between we shall discuss something about the lung abscess. As I discussed earlier yesterday, from my previous lecture, you know, the atypical pneumonia is also known as interstitial pneumonia. In this particular pneumonia, the inflammatory cells, they are present in the interstitium. Now this is a very interesting observation that you should make about this atypical pneumonia. So I want you to see this picture which I am trying to draw here to understand how the atypical pneumonia look like. So this is what I am drawing, is an alveolus. So this is an alveolus, you can have a look here. Now this is another alveolus by the side of this alveolus. So this, now you can see there are two alveolus. Now can we see some space in between these two alveolus? Can we see that space? Yes, the space you see here, which I am putting an arrow here, is the interstitium. Now in the patient with a atypical pneumonia, this is the interstitial space that contains inflammatory cells, and these inflammatory cells are typically lymphocyte, plasma cells, and sometimes they are macrophages. Now since this disease is present in the interstitium, we are calling it interstitial pneumonia. Did you notice one thing? That in this particular disease, alveolus, they are completely okay. There is no exudate, it is almost empty. So the patient will have a cough, and this cough is a dry cough. There is no exudation naturally because the inflammatory material there in the interstitium. That is why it is very dangerous disease, and the infection remains in the lung, so it has got a bad prognosis. Now let us come back to the agent that can produce this atypical pneumonia. We have to remember chlamydia, mycoplasma, and the viruses. So what are these viruses? They are the respiratory syncytial virus, para-influenza virus for the children. Now we can see the influenza virus A and B, and adenovirus also can be a cause of the atypical pneumonia. Not to forget about the SARS. We had a lot of discussion throughout the world regarding the SARS infection. Recently there was a child from the school in China. She died because of the SARS infection. Now this virus usually mediated via poultry infections, or mediated via the chicken or this kind of poultry products. So it is very dangerous to eat those kind of chicken, processed chicken or egg, because this virus can be transmitted by eating those infected, contaminated products. Now this is the morphology, as I already discussed with you. Now to understand the morphology, once again you need to go back to the previous picture which I already showed you. So what we see here, if you look at these empty spaces, the white clear spaces, they are the alveolus. So you can see this is an alveolus, this is another alveolus, please follow the cursor, this is another alveolus. Now the space between the alveolus, which are apparently very prominent here, is due to inflammatory infiltrate. So if you look at the picture, the drawing that I was trying to draw earlier, so in a situation like that, what happens? In a disease like that, what happens? These inflammatory cells will be present in this interstitium. As a result of this thing, the interstitium become much more prominent. which is a very unusual case, very abnormal case. And since there is inflammation, we can see some type of fibrosis also in this interstitium. As a result of this thing, the pulmonary capacity, the pulmonary compliance, everything should be reduced, and the patient definitely will have a serious lung condition. This is the picture. Of course, I think there is a bigger picture for that. I want you to see this picture first. Please look at the monitor. You can see this is a blow-up magnified view of interstitium of the lung as well as the alveolus. So what we see here, we can see that this interstitium now becoming very prominent, and which is containing lots of cells. Can we see all these blue dot cells? These blue dot like cells are lymphocytes. We can see some congested blood vessels. You can see there is a congestion in the blood vessels. Overall, what we can see here, the thickness of the entire interstitium is much more than normal. But what we see, these alveolar spaces are empty. It means there is no exudate in the alveolar spaces. So this is what is the appearance of the interstitial pneumonia. Let me go back to the previous slide. Atypical pneumonia, the most common agent is Mycoplasma pneumonia. So whenever we discuss about the atypical pneumonia, unless there is some kind of other indication, Mycoplasma is the most common agent. Now remember, whenever there is a Mycoplasma infection, our body will show an elevated level of cold agglutinin. I think you know what is cold agglutinin. Cold agglutinin is a kind of immunoglobulin. What class of immunoglobulin? They are IgM type of immunoglobulin. Now this immunoglobulin is known as cold agglutinin because, I hope that you can remember from your microbiology class, this immunoglobulin is a very large immunoglobulin, very big in size. So this immunoglobulin, if it is present in the serum, it will produce something. Now I want you to draw the picture so that we can understand how this immunoglobulin works and why it is known as cold agglutinin. So this is a IgM molecule, which is a very big molecule. Now since it is very big, what happens? If the molecule is present in the serum, it will cause agglutination of the blood vessels. Agglutination of the RBCs. Normally the RBCs are all separate like this. All RBCs are separate. When they are moving into the blood, they do not clot together. But if the IgM is present in a very high quantity in the serum, what happens? This IgM will allow these RBCs to aggregate together. This is exactly what it happens. There is the IgM molecule. Now it will bridge all these RBC together. One IgM molecule can bind with 5 RBCs. Now if all these RBCs are bound like this to the IgM molecule, they produce an aggregate or clot. Now what we see? We can see numerous such clot in the blood, and this clot sometime inhibit and stop the flow of the blood, and as a result of this thing, certain area of the body or the area which is blocked by this blood clot may undergo ischemic change, and that is the most dangerous aspect of the Mycoplasma infection. So as we see that in addition to having some serious lung condition, this Mycoplasma infection produces a huge amount of IgM, which will aggregate all these RBCs together to produce a clot. Remember, it is a clot but not a thrombus. Now how to diagnose this?